Hi, it's me, Dr. Namfez, and today I'm going to talk about a little bit about psychology of pain. Many of the physicians that are working in the environment are very unaware of the fact that emotional trauma is something that can tear or break a person as a whole. If someone has got trauma or someone has got some disease and that person is in emotional imbalance, until and unless you treat the disease of that person, the mental disease, that is emotional instability, lack of sound words from the physician, that patient can never ever heal. In our practice, what we do usually that we ignore the emotional needs of the patient. We just focused on the medicine. Like in case of pain, patient kept on complaining of pain. We don't realize that painkillers sometimes are not effective just because that person is in emotional trauma. We have to give a positive hand, helping hand, and very supporting words to help that person to heal emotionally. Even if you give the medication and treat that person and you ignore the psychological side of that patient, then as a result, what happens that the patient keep on suffering for emotional trauma, as a result hormonal imbalance, as a result suffering physical health improvement level doesn't go at the same rate as compared to the patient whose physician is guiding and helping the patient emotionally, counseling that patient emotionally. So it is very important. I request to all of the Pakistanis, doctors and physicians, all of the over the world, over Asian countries, and whoever is listening to me, please give some moments to the patients so that they can understand that so that they can listen a few words of healing from you, and you will ultimately realize your patient quantity and will improve. As a result, more and more patients will rely on you and your patient practice will improve. So please, in your free time, either listen to some psychological videos on your patient's perspective, either you can go to some psychological books that are very effective. So in building your perspective more on that, like in my case, I try my best to talk about on psychological topics with my friends and colleagues. As a result of that, it gives them inspiration to know more about that mental health, to bring a positive outcome among the patient. So this is all for today. Thank you so much for hearing me. Thank you.